and it could be a little threatening, like you're interrogating them, like, are you using fentanyl? What I recommend is do it in the car. You know, you're both sitting, you're driving, your eyes are on the road, and your son or daughter's next to you, and so you can kind of talk when you're not looking at each other, so it's less threatening. And again, make it about their friends. You know, like, not are you using fentanyl, but you know, how do you feel about other kids using fentanyl? Like, what would you do if someone offered your friend fentanyl? What would you say? So, a very good point about approaching the topic from the back door. The patients that I see that are most often using fentanyl are teens, and they're teens that are hurting with mental health issues. That seems to be the primary driving force behind it. I know that it's been in the media a lot about about mental health issues with teens. If you're depressed or you're anxious, it's kind of awkward to talk to a medical professional about those things. You have to find a counselor. And you have to have patience with it. And teens, unfortunately, are turning to substances, whether it's fentanyl or cannabis or meth, because instantaneously those feelings of hurt go away. To answer your question, that's the majority of the patients that I see that are using fentanyl are those that are just hurting. They're just depressed. They have hard lives. And it's kind of a quick and easy fix. If you had a student or a loved one or a child, some of the first things you might see is an altered level of consciousness or a complete loss of consciousness. You'd also see a lack of the respiratory drive, so shallow breathing or not breathing at all. You might also see something called cyanosis, which is the bluish coloring of the lips. And you could try to arouse the patient by giving like a sternal rub or shouting at them. They might just be sleeping from another reason. But those are some of the telltale signs. The other thing too, which is a little bit more medical, you might want to open their eyes, and if they have pinpoint pupils, that's another sign that their overdose would be a cause or be caused by fentanyl. It's a bit complicated because there's other substances out there. People can overdose on meth and cocaine and other things, but as far as fentanyl, not breathing or barely breathing, pinpoint pupils, and bluish lips.
Awesome, thank you.